I'm Deborah Cools, and I'm the Associate Dean for Research at the Kirk School of Medicine at UNLV. And thank you so much, everyone, for joining us for our monthly research seminar. Tonight, we're going to be talking about writing for scientific publication. And this is going to be part one of the series. And Dr. Pharr, if you can advance the slides. We'll be introducing Dr. Pharr in just a minute. And I would really like to thank the Research Seminar Planning Committee for bringing this topic and the speaker to us. My co-chair is Dr. Kavita Batra, who many of you may know. Karen Gordon, who's our Administrative and Grants Director in the Office of Research. Kathleen Danheiser, who's our Grants and Research Coordinator, also in the Office of Research, and Molly Drader, who's our Administrative Assistant, and she has done a lot of the work to bring the seminar to you. Next slide, if I could. And disclosures, we actually have all faculty and planners and anyone else in control of this educational content. They have to disclose. They do not have any relevant financial relationships to disclose. And this seminar is organized by the Kirk School of Medicine at UNLV in our Office of Research. And this is really a learning opportunity for all researchers. Young and old, and irregardless of whether you're still in a learning role or an attending role, and we're actually all in a learning role. So again, no relevant disclosures. Next. So some important information, and some of this is housekeeping. Again, this is a presentation for educational purposes only. We ask you to turn off your video during the presentation to preserve bandwidth, and I'll be turning mine off shortly. And this session is being recorded, so I'd like to remind everyone of that. At the end, a PDF version of the presentation will be shared by all participants upon completion of the presentation, and we will ask for your evaluation as well. During the seminar, if you would post your questions in the chat box, and we'll answer them at the end. If there are any follow-up questions that come into your mind after the presentation, feel free to email us at our research at medicine.unlv.edu email address. And next one. Okay, and for those of you where clinical or continuing medical education credit is useful for continued licensure and other reasons, we wanted to let everyone know that this session has been approved for 1 hour of AMA Category 1 credits. And for those of you that CME is not relevant, we also give a general certificate of attendance. For both, you have to complete a survey, and we'll give you more information at the end of our seminar. And we're always concerned about continued development, whether we're in a learning role or in a faculty role. And we suggest that you include this activity and either your certificate of attendance or CME in your own evaluation. So for faculty, it's interfolio, and for administrative faculty, you also have an evaluation process, and you can add that into your evaluation. And we are very delighted to introduce again Dr. Jennifer Pharr. She's been really generous for her time and knowledge with us, both in the past and today, as well as in part 2. And for those of you who are not familiar with Dr. Pharr, she's a professor in the School of Public Health's Environmental and Occupational Health Department. She has many research interests, and they include disparities in healthcare access and health service utilization, specifically in vulnerable populations, and including those with sexual and gender, I'm sorry for stuttering, minority populations. She has a lot of interest in disparities within diseases, including HIV, mental health, and chronic diseases. Also barriers that impede and prevent populations from seeking treatment, and also in disease prevention. She uses social marketing to promote health, and one of her other interests is the intersection of sport, physical activity, and health, and using sport to advance health, especially among women. And without further ado, I'm going to turn this over to Dr. Pharr, and she'll start with our learning objectives for this evening. Again, thank you for attending, and I hope this is a valuable learning experience for everyone. Thank you.
Thank you, Dr. Cools, for that introduction, and thank you all for being here today. It's always a pleasure to talk about technical writing and scientific writing. I do teach a class in the School of Public Health in the spring semester EO8 709. If you're interested in learning more and having a whole semester worth of information, this is sort of a 2-hour version of the class that I teach in the spring semester. So the learning objectives for this course is that you are able to describe the importance of scientific and technical writing within a clinical setting at the end of this 2-part educational experience, that you can describe the components of a scientific paper to both physicians and researchers, and that you're able to discuss the writing components of scientific paper sections to inform the discussion with physicians and researchers on how to convey concepts for application to clinical patient care. And I apologize if you can hear my dog barking. Something was supposed to be delivered early today, and of course they're delivering it right now. Timing is always great that way. So this is part 1 of a 2-part series talking about scientific writing. And yes, there is such a thing as technical writing humor. So if any of you have ever submitted a paper to try to get it accepted for publication, you know that that can be somewhat of a daunting experience. So this cartoon, most scientists regard the new streamlined peer review process as quite an improvement. And you can see the people there with clubs and swords and stuff, that being the new improved peer review process. So we do take everything with a little bit of humor and scientific writing, because we know that, you know, sometimes it can be quite a road to get things published. It's important to always give credit where credit is due. A lot of information that I'm going to be talking about today has come from the How to Write and Publish a Scientific Paper. On the screen, you see the cover for the 6th edition. I think it's now in the 8th edition, most recently published. And I got a hold of this book when I was first beginning to submit papers for publication. And I had one editor. He could have, you know, told me, like, your writing is terrible, don't ever send another paper to my journal again. But instead, he was very generous, and he gave me the information for this book and said, you know, I really just recommend that you get this book and use it in your writing. And it has made all the difference. Now I have over 120 peer review publications, and I attribute a lot of it to this book and really learning and diving into how to write. Also, Dr. Mark Butner from the School of Public Health, he used to teach the scientific writing class and gave me a lot of his information that I use in my class and that I use in my writing. So again, I always want to give credit where credit is due and recognize those who have helped us along the pathway to our better writing as well. So let's just talk a little bit about scientific writing. And the key characteristic of scientific writing is clarity. We want to be clear with our writing so that the people reading our writing can understand exactly how we did the study that we did, everything that we did in our methods, and then what our results were and what meaning we can find from those results. The purpose of scientific writing is to communicate new scientific findings, right? You've done a clinical trial, you've done research, and you need to give those findings to people in your scientific community who need that information, right? So maybe you've done a drug trial and the new drug is better over the gold standard drug, right? And you need to communicate that with other physicians so that they know, hey, I should be using this new drug rather than the old drug, or this new formulation, or this new methodology, or whatever. So we want to be sure that our writing is clear, precise, and simple so that people can clearly understand what we did and how we found our answers. In scientific writing, we're writing to communicate. We're not writing to impress. So in scientific writing, if we are using a rose, it's not symbolic for love or passion or something like that. If we are using the noun rose, we are really actually talking about a rose. It's not symbolic, right? We are being very simple and precise with our wording in scientific writing. So I came across this matrix a couple years ago, and I thought it was sort of a good way to emphasize what is really good writing and what is not really good writing. So the appropriate sentence pattern, usually short and less elaborate, works best when we're talking about complicated subjects. So if the subject matter is complex and the average sentence is easy to understand, that's really good technical writing. If the subject matter is complex and the sentence is hard to understand, that's sort of our typical technical writing. If the subject matter is simple and our sentence Again, I apologize. So if the subject matter is simple and their average sentence is easy to understand, that's just good, simple, honest writing. But if our subject matter is simple and the sentence is hard to understand, then that might be a bit of BS, right? Someone's trying to inflate the importance of their writing or make it appear to be something more than it is. And that's not something we want to do whenever we're talking about scientific and technical writing. So a little bit more technical writing humor. This professor is saying, no, if you make the paper too easy to understand, everyone will know exactly how you got your results. Which actually what we're going for in scientific writing is the complete opposite. We want to make our paper easy enough to understand that everyone will know exactly how we got our results. So that if they want to replicate our study, they're able to do that. If they want to do it at some future point in time, or if they want to do it in another location or with another patient population, they're able to do exactly what we did. We want our writing to be that clear and that easy to understand in scientific writing. When you're engaging in scientific writing, it's something to remember, and a phrase that I use often with my technical writing students and with my graduate students is this idea of economy of words. So you want to say something in as few words as you can. Again, you don't have to go on and on about a subject. You don't have to use fancy terminology. You can use simple, clear words. And that's important to remember because one, everyone is busy, right? We're all busy. We're all inundated with information. So if you can say things short, people are more likely to read it and more likely to understand it. And then we're thinking about our world of scientific publications. Journals had word limits for their manuscripts. So in the health sciences, it's everywhere from 1,500 to 3,500 words is typical for a journal. Most journals I publish in are 3,000-ish words. And so you can't drone on about something when you only have 3,000 words to go from the introduction to your conclusion, right? So we have to be really conscious about the words in our word selection. It's also important to, before you start writing, to establish your mindset for scientific writing. Again, clear and simple. What was the importance of your study? What did you do? What did you find? And then what does it mean? And it's also really important for all of us to realize that the first draft, the first version of our manuscript, our paper, maybe some of you in graduate school, your thesis or your dissertation is never going to be perfect. I listened to a podcast just a few days ago of Anne Lamott. She's written over 26 books. She's very prolific. She's been writing for a very long time. And she's the one who came up with the slogan. I'm not going to use the the word that she uses, but it's kind of like the crummy first draft, right? Your first draft is never ever going to be perfect, and you have to establish this idea that you're going to have to revise. You're going to have to revise your manuscript. You're going to have to revise your term papers. You're going to have to revise your thesis or your dissertation. And that's just part of writing. It's never perfect the first time. It's important also to really to know yourself and to know what works best for you. So how do you write? Do you write best, and how do you write your best, right? Do you write best maybe in your office with your laptop? Do you write best with a pen and paper sitting out in nature? Do you write best in a cafe, a crowded cafe with other people talking? For some people, that really helps them to focus in on their writing. Some people, my students especially, will tell me they write best, sort of that cartoon character up in the right-hand corner of the screen. Oh, Dr. Pharr, I do my best writing when I'm under pressure. So like the night before it's due. I will argue with them and say, probably not. Maybe you think you do your best writing when you're under the gun, but most of us don't do our best writing. And that leaves no time for you to revise and go over it and make sure that everything is clear and that you've selected the best words that you could to describe your information. So it's important to know when is the best time for you to write. Are you a morning writer? Are you a night writer? Are you a evening writer? To know where is the best place for you to write again, and then to know how is the best way for you to start the writing process. Do you write best brainstorming? So just writing down a bunch of incomplete sentences and then organizing your ideas. Do you get started best by talking to your friend about what you're thinking about writing and then generating ideas that way? Do you write best by doing free writing? That's something that I'm a big fan of, where you sit at your computer and you just start writing, and you write for a length of time, writing complete sentences, but not going back and making sure that every word and every sentence is perfect to start with. I know a lot of us get bogged down trying to come up with a perfect sentence, and that kind of can stifle the writing process. So it's good to know what works best for you, how, when, and where when you're doing your scientific writing. So as you start writing, it's also important to think about trying to do some time allocation to your writing. So if you can allot a certain amount of time to your writing each day and space out your writing, that prevents getting fatigued. I'm sure all of us have had the experience where we've sort of put off our writing. And it's like, oh my goodness, I have to get this paper done. And so we sit down and we try to write for 5 or 8 hours in a row, and you get tired, right? And your brain quits working after a while. So if you can space out your writing and allocate a certain amount of time block each day to writing, it prevents fatigue. It allows for aha moments, right? You write something, you walk away from it, then you come back to it, or maybe sometime later in that day, you're like, oh gosh, I was struggling with how I was going to say that. Oh, now, aha, I know how I'm going to say that. And also you can start each session with a fresh perspective and a fresh set of eyes, reading what you've written the day before. So it's better to write 1 hour a day for 5 days than it is to try to sit down and write for 5 hours straight. You can just get fatigued, and we get some writer's block that way. Tara Gray published a book titled Publish and Flourish. Some of you may have heard in academia the term publish or perish, right? As faculty, we have to publish, and if we don't publish according to the standards set by our school or our department, then we might not continue to have our job, right? So her suggestion is that you write for 15 minutes every day. And she has a podcast or a YouTube, and she talks about how she writes 15 minutes every day, even on the weekends, even on vacation. Her family gets a little bit tired of her writing every day, but that's her system for publishing and flourishing. For me, 15 minutes isn't really enough time to kind of go back and look what I wrote yesterday and get myself organized for today. I'm more of an hour writer, but again, you need to know what works best for you, both time and space and place and all of that. A couple of years ago, I came up with the anatomy of a scientific paper when I was thinking about my technical writing class and how to really help students visualize a manuscript, or when I say manuscript, I'm talking about the same thing as like a peer-reviewed publication, right? Scientific paper. Can think of it even bigger. You would use the same anatomy for a thesis or a dissertation, but those are a lot longer, but have the same components as a scientific paper. You start with your introduction, and you can think of that as an upside down triangle. So you need to start with your big opening statement. You need to grab the reader's attention, grab the audience's attention, and tell them why it is important, why your study was important, right? So I've done a lot of work, as Dr. Cools talked about in my little bio, in HIV prevention. And a good big opening statement for me, if I'm talking about like HIV testing or HIV prevention, might be that globally, 37 million people are infected with HIV. This is a big problem, right? So that big opening statement lets the reader know, okay, this is not just a couple people problem. This is a millions and millions of people problem. So this is a big problem. And from there, you want to funnel your introduction down to the purpose of your paper. And we're going to talk really specifically about the introduction in tonight's section or part of this discussion that we're having. By ending with the purpose of your study, then you can move into your methodology with your methods or your methods. This is how you did your study. Plain and simple. Just this is how you did it. You can kind of think of it like a recipe, right? First we did this, then we did that, then we did that, put it in the oven, let it cook 420 for 15 minutes, and then now here's the result, right? Your results are your results. And in part 2, we're going to talk more specifically about methods and results. Then your discussion, and you can see that the discussion looks like just the opposite of an introduction. So we start with what were our most important findings, and then your discussion ends with your big closing statement, or what did we learn from the study that we conducted. We're going to be talking again, spending the rest of the night talking about the introduction and the discussion sections of a scientific paper. The introduction. So the purpose of the introduction is to give enough background information that the reader can evaluate your study. You need to provide a rationale for why you conducted your study. So why did you choose your topic? Why is it important? So again, we start broad and we narrow down to the purpose of our study, which the purpose of our study is our clearly stated either objective or purpose of the study. So the purpose of the study was, the objectives of the study were, something like that to close out your introduction section. So if we think of that triangle and like, okay, how do we funnel down from this big opening statement to my purpose statement? So the first paragraph of your introduction could be your general opening statement, providing the magnitude of your specific problem. Then the next paragraph, usually a good scientific paper has about 4 or 5 introduction paragraphs. So it'd be more specific to the purpose of your paper. So maybe the magnitude of the problem within your setting. So if globally 37 million people are infected with HIV, but my paper is looking at HIV testing and prevention in Nevada, then the next paragraph might talk about, well, what is the HIV landscape in the state of Nevada? Then the next paragraph would be more specific to your purpose. So what do we know? So maybe I'm writing a paper about increasing HIV testing among adolescents in Nevada. So what do we know about testing of adolescents in general, right? What do we know about that? How do we get them to engage in HIV testing? And then more specific to the purpose might be, well, what are the gaps, right? Maybe we know globally what gets adolescents to engage in HIV testing, but we don't know in the state of Nevada what's going to get our adolescents to get tested for HIV. So I would identify that gap for the reader, and then we get to the purpose of the paper. So I like to think of it sort of like I'm taking the reader by the hand and I'm kind of walking them down from the big opening statement to the purpose of my study. Like, hey, this is a really big problem. There's 37 million people infected with HIV, but did you know about this in Nevada? And did you know adolescents are the most likely to be infected? And you know that we don't know what it's going to take to really get adolescents in Nevada tested. And so that's why I'm doing my study. So you can kind of think about it like that. So some good rules for introduction. So you want to make sure that you present the nature and the scope of your problem very clearly, again, for the reader to be able to evaluate your paper. You want to make sure that the reader knows, what do we know and what don't we know? Where are the gaps and what gap is your study going to fill? You want to state the objective and purpose of your paper. And sometimes in some disciplines, they might sort of allude to what methods are going to be used, maybe not. Principal results and conclusions in the health sciences, we don't talk about that in the introduction. We make our readers wait until the results in the discussion sections of the paper. So the goal and purpose of your study, there can be several different things that you're trying to do with your study, or different purposes for different studies. So maybe you're trying to fill a gap in knowledge, right? Again, we know what it takes to get adolescents to get tested for HIV in Nigeria, but we don't know what it's going to take in Nevada. And so that's the gap that we're filling. Or maybe you're testing or comparing procedures. Maybe you've always done this certain medical procedure this way, but there's new technology, and you're going to test and see if this new technology could do the procedure better, right? And so you're going to compare those two different procedures. Or maybe you've developed a brand new methods. Maybe you're working with Dr. Batra and she's developed a new statistical method, and you want to present that to the readers, a new way of doing some sort of analysis. Or maybe you're reviewing the literature. So you're taking all the studies that have been done about a specific topic over a certain amount of time, and you're providing the reader like everything that's been found in previous research, so that if they're looking to do maybe a smoking cessation intervention, they can go to your paper and say, okay, this is what the literature is telling me over the last 5 years has really been impactful for helping people stop smoking. So I'm going to make sure that I include these in my intervention. Or maybe you're testing a hypothesis or trying to answer a research question. So whatever the purposes of your study, typically it falls under those 5 different categories of goals or purposes of a study. Your introduction can be divided into sections, each with its own heading. This is probably more common seen in like a thesis or a dissertation where it's quite lengthy, but sometimes it's important to do that in a manuscript, especially or scientific peer-reviewed publication, especially if you're kind of having to jump from one topic to another topic, that it's hard to just do that with a transition sentence. Maybe it's like, okay, I need my reader to know about a little bit of history and then a little bit of policy. And so I'm going to make headings for those. That's perfectly acceptable. So again, you conclude your introduction with the purpose or the goal of the study. And that just sort of naturally then leads the reader into the methods and materials section of your paper. So the goal of the study is to identify barriers to HIV testing among adolescents in Clark County, Nevada. And so then my methods and materials, I start talking about, well, how did we identify adolescents in the state of Nevada to be subjects of the study, right? So it goes sort of naturally, just leads right into the methods and materials section of your paper. Again, we go back to this anatomy of a scientific paper that we've talked about. One thing that's important to think about whenever you're starting to write is you can start anywhere in this anatomy of a scientific paper to build momentum and get your writing started. You don't have to start at the introduction first sentence and go from there, right? If you're working on your methods of your paper, if you're working on the methods of your study, go ahead and write that out. Write down exactly what you're doing. That way, whenever you're writing your paper and you go back, oh, I did this study 6 months ago, and I'm going to try to remember what I did when hopefully I took good notes about my methods. No, go ahead and write the method section, right? When you're doing your data analysis, go ahead and write the results section. I really have started to write my papers that way, where I focus more on the methods and results. I have my purpose of my study, or else I wouldn't have known what to do for my study, right? But I go ahead and write the methods while I'm doing it. I go ahead and write the results. And then I visit the introduction and discussion and work those two sections as a pair, right? Based on my results, what am I going to talk about in my discussion? And based on what I want to talk about in my discussion, how can I make my introduction for my paper make sense and be on point and on topic with my discussion. Okay, let's talk about the discussion. So again, you can see where the introduction and the discussion work is a pair. They're the mirror opposite of each other. Your introduction starts with your big opening statement, so the why of the paper, and then your discussion closes with a big closing statement. So what did we learn from this study? Your introduction ends with the purpose of the study, and your discussion begins with this is what we found. This is the most important finding from our study. All right, let's talk about the discussion section. Again, the introduction, the discussion work is a pair. The introduction poses a question. So this was your research question, and then your discussion answers the question that was posed in your introduction. One thing to remember is you don't want to include anything in the discussion that you didn't at least mention in the introduction. Maybe you didn't go into depth about it in the introduction, but you at least mentioned it. So that when the reader's reading and they get to your discussion, it's like, oh yeah, right. They talked about some behavioral theories. And so in the introduction, so now I understand why they're talking about, they think that they found what they found in the study based on these behavioral theories, right? So you want them to not just be all of a sudden come out of left field with something that you put in your discussion. You want to think about including some information in your introduction. That's why it's sometimes good to wait and write your introduction discussion after you have your results, after you know what you want to talk about in your discussion, so that you can include that information in your introduction. And you can start anywhere in the anatomy of a manuscript. The discussion section of manuscript, I think, is probably harder to define than other sections. I see that most of my students, both in my technical writing class or my students that I am mentoring, have never written a discussion section, right? They've written what sort of resembles an introduction in research papers that they've turned in class. Hopefully they've written a methods section in their research methods class. Hopefully they've written a discussion, a results section in their statistics class, but they've never written a discussion section until either they take my technical writing class or they're writing their thesis or dissertation discussion. It's something that we don't get to practice a lot in school. So it's a hard section to define. It's usually the most difficult part to write because a lot of people tend to want to repeat the results section, but that's not what a discussion section is for. It's to explain the findings of your study, not just to repeat the findings of your study. Often the discussion section is rushed, right? Especially for our students, if you're trying to finish your thesis or dissertation and graduate in the time frame that's set up by the graduate college, it's like, oh my goodness, I have 1 week to write the discussion section when I took 3 months to write the introduction and 2 months to write the methods and 2 months to write the results, right? I have to hurry up and get this written. So you want to make sure, again, that you allow enough time to really write a thoughtful discussion. Don't want to repeat the results. And it doesn't need to be too long or too verbose, right? You, again, economy of words, you want to be able to be efficient with what you say in your discussion part of your paper. I still, when I write a discussion section, I really kind of have to sit myself down and go, okay, all right, you can do this. You can think through this. You can discern what are some of the reasons that you found what you found and relate that to other papers. There are two ways to approach writing or starting a discussion section. Number one, you can either reacquaint the reader with the reason for your study. Remember HIV, there are 37 million people globally affected with HIV around the world, but we really don't know what barriers there are to HIV testing among adolescents in Clark County. So this is what we found. This is the purpose statement, and then move on to there, like, this is what we found in the barriers are X, Y, and Z. Or you can begin your discussion with a statement such as, the most interesting findings for this study are the most important findings of this study, right? The most important finding for this study was that lack of knowledge about HIV and other STIs among adolescents in Clark County was the most important finding from this study, something like that, right? So in your discussion, you want to present generalizations or relationships. You want to make sure that you can compare and contrast what you found to previous work, right? So maybe what I found as barriers to HIV testing among adolescents in Clark County, Nevada, may be very similar to barriers to HIV testing among adolescents in sub-Saharan Africa, or maybe very different, right? So I want to talk about that. How are they similar and how are they different, and why might the barriers be different in Clark County, Nevada compared to sub-Saharan Africa? You want to point out exceptions or lack of correlations or define any unsettled points, right? You may have hypothesized that the barriers to HIV testing among adolescents in Clark County, Nevada are going to be X, Y, and Z, but maybe you didn't find that. Maybe when you really dug into your data, you found out that it was something completely different, right? So you want to talk about, hey, I hypothesized this, but this is not what I found, and talk about why that might be. You want to discuss any theoretical implications or applications of your work. Okay, you found this, so how can I apply that, right? How could someone out in the field apply what you found? How could someone in a clinical setting apply what you found in your research to their daily practice? So you want to make sure that you discuss that in your discussion section. You want to present any advantages to your study, any strengths of your study, any limitations of your study, and then you want to make sure that you have a clearly stated conclusion section to your paper. So again, your discussion, you want to briefly restate the important findings. And when I say restate the important findings, I don't mean go back to your results and cut and paste, right? You don't need your p-value. You don't need what the f-value was. You don't need to point out the table, their figure number, where these results can be found. You don't need to put any of that, right? You can say that something like the control group, the intervention group was significantly more likely to engage in smoking cessation than the control group, right? Remember that from the results? Okay, now let's talk about why did we find that? Again, talk about how your findings relate to previous findings, like previous findings found these same things, or previous findings found something different, and we think this is why we found something different in our study. You want to use previous research to help explain your findings, right? So it may be that you go back to behavior theory to explain, we know we did this intervention and we did these sort of things, and we think based on the social ecological framework, this is why we found the results that we found, right? You want to, again, note any applications or implications of your findings, and then identify any unanswered questions for future research, right? That's how we move research along. So this is what other people have done. This is the gap I identified. Here are my findings, but I know that I haven't answered all the questions about this research. So here's another gap that researchers in the future, maybe you, but researchers in the future should look at to help further this research or our understanding of this phenomenon. You want to, towards the end of your discussion, you want to talk about the strengths and limitations of your study. Don't be shy about talking about the strengths of your study, right? You may have had a better experimental technique. You may have had a much bigger sample size than previous research. You may have done a much longer follow-up than other studies. Maybe other studies did an intervention and then followed up 2 weeks later. And oh, look, the intervention group is still successfully not smoking. But maybe you followed up for 6 months or a year and your intervention group still isn't smoking based on your smoking cessation intervention, right? So you want to talk about that. Hey, this intervention was so good that it lasted a much longer time than we've seen in other studies. But you also need to be really honest about the limitations of your study. It's important that you identify the limitations of your study, because if you don't, someone else will, right? A reviewer, an editor, your thesis or dissertation chair. So you want to be honest, and every single research study has its limitations, and it's good to identify those for yourself. So you want to talk about, maybe you had bias in your sample. Maybe there's potential for bias in your sample, right? So if you did a cross-sectional study and you went out and recruited folks, maybe the people who participated in your study were more likely to have an interest in your study than people who didn't participate in your study, right? There may be self-report bias. So if I'm asking adolescents in Clark County about barriers to HIV testing, they may sort of report things that they think are socially acceptable, right? If I'm asking, especially sort of personal information, like how many sex partners do you have, right? They may kind of go, I think the socially acceptable answer to this question is 1, even though I have 10, right? Or if we're talking about smoking cessation and we ask patients about how many cigarettes they smoke a day, they may think, a 10 a day sounds more socially acceptable than 3 packs a day. So I'm going to say 10, right? So we have to recognize that there are biases in every single study that we do and identify those for our readers and be honest with them. Towards the end of our paper, we want to have a conclusion paragraph or conclusion section. We want to tell the reader the significance of our findings. So it's kind of like the so what of your paper. Okay, you told me why it's important. You told me what you did. You told me about your results, but so what, right? So we want to make sure that we end our paper, our conclusion paragraph, our conclusion section with a bang rather than a whimper, not just, okay, thank you for reading my paper, the end. No, it's like, okay, this is what we found in our paper, and this is why it's important, right? We found that our intervention was successful for this. And so this is important. If you're going to do a smoking intervention, if you're going to do an HIV testing intervention, it's important that you consider these things that we found in our paper. However, you don't want to overreach your conclusion, right? You most likely haven't found a cure for cancer in your one study. You don't want to overreach your conclusions, but rather you want your conclusions to be supported by your data and by your findings from your study. In your conclusion section, you don't need to reach some cosmic conclusion. It is unlikely that you will illuminate the whole truth of a phenomenon, but rather we as researchers, we each shine our little spotlight on one area of the truth. And if we're all shining our spotlight on a phenomenon, eventually the whole thing will be illuminated and we will understand the real truth of a phenomenon. And again, at the end of your paper, you want to make sure that you make recommendations for future research. I know as a researcher, I love that when the researcher says at the end, the next research should look at X, Y, and Z, right? If you're a student and you're looking for a topic to do your thesis or dissertation, look at that recommendations for future studies at the end of the papers that you're studying about the phenomena that you want to study and see, well, where should your research go? That's a really good way to identify gaps in the literature. And with this, I believe I'm going to turn it back over to Dr. Cools.
Yes. So this, we wanted to introduce all of you to sort of a framework for looking at clinical research and writing it up, and sort of a metric that you can develop. Excuse me. And it's called SMARTY. Obviously, your research, as you look to translate it to your patient population, should be very specific. And also, when you're reporting your results and other portions of the paper that Dr. Pharr talked about, be very specific. Yeah, what population does this really apply to? And hopefully, this allows additional measurability of in terms of interpretation of results. And as we look to translate this to patients, is this really attainable? Is it doable? Is it relevant? Is it timely? And we always want to have a lens of inclusion and equitable. So this is an acronym that might help some of our participants, and you might even think of when you are either writing up results or reading, to think about 3 instances. And I think they went backwards. Okay, and then we can go on to the next slide. And so we wanted you all to save the date for part 2 of Writing for Scientific Publication. You'll be getting an announcement soon, but it will be May 9th at the same time. And again, you'll be getting a flyer. And of course, we want to thank you for attending our seminar tonight. We'll give you the evaluation link in just a minute, and we'll keep the survey open for 2 weeks until May 9th, which is the date of our next seminar. And you'll be able to also get your CME certificate or certificate of attendance. And then we'll move on to questions from the audience. And I'm not seeing any in the chat, but people can unmute themselves and ask questions. And then in the meantime, if we can go on to the next slide, because I think it gives the QR code. Yes. So you can use this QR code to do your evaluation and also to get CME. And you'll be getting an email from us as well. You'll want to use activity code 1120. So while people are doing that, let's open it up for questions.
Looks like Amanda Morgan has her hand raised.
Oh, okay.
Hello. Thank you, Dr. Pharr,
Hello.
for doing this.
Thank you.
I I was curious if you had any advice on turning dissertations, which are over 100-page long document into like articles, because I've definitely been kind of struggling with the jump starting of that. And just curious if you had any advice.
Yeah, thank you, Dr. Morgan, for that question. That's a great question. Likely in your dissertation, you had a couple of research questions, right? And so I like to think about dividing up a dissertation based on those research questions and start with the question, how can the research question and then the results that relate to that question. So you can go ahead and get those two sections, just break everything out, right, by those different categories. And then think about your methods and how what maybe is specific to that research question. So you can break that out. And then what's similar and how can you paraphrase that, right? So that you're not self-plagiarizing. I would start there and then go back to the introduction that you wrote. Okay, what parts of the introduction are specific to research question 1? And what part of your introduction is specific to research question 2? Do the same thing with your discussion. And then then start to revise those 2 or 3 different manuscripts. That's a great question, though. It's a hard thing to do. Sometimes with my students, I will volunteer because I know they've worked with this information for so long. They're sick of looking at it. It's like, let me take the first stab at tearing everything apart that you spent all your blood, sweat, and tears doing, and then I'll hand it back to you, right, to take it from there. But our words are precious because we wrote them, and it can be hard, right, to tear that apart. But I think just start out, here are my 3 questions, here are my 2 questions, the results that go to those, the discussion points that go to those, methods, and then go from there is a really good way to start.
Thank you.
I agree. This was a great question. Thank you, Dr. Morgan, for asking. I did the same thing for my dissertation. So I divided, Dr. Pharr was my advisor. So I divided my dissertation into 2 parts. And one thing that I also did in my dissertation is that I used some part of my literature review for discussion section. So there were like some paragraphs that I moved over to discussion section, because in dissertation, I think we don't write that extensive, discussion section. We just end at the report, like result section, right? So discussion section is still pending. So we can build up discussion section from our literature review that we have done in the dissertation.
Something that was very helpful for me, and this is Dr. Ravagan, and it's Dr. Pharr was also my advisor. Something that was very helpful for me was to think about the papers, the publications that will come from my dissertation, even before I started writing it. So it helped me with the tables, like trying to think ahead. That helped a lot for me to publish quicker.
That's great. Both of those are great pieces of advice.
Thank you so much.
I have one more thing for Dr. Pharr. So Dr.
Mhm.
Pharr, do you recommend that we should make an outline of the introduction section, discussion section before we jump into the actual content? because I started using this strategy with medical students, our residents and fellows, and I think this is working really like in, it's productive approach where they actually make up an outline and then they come to me and then we decide like the flow and then they fill out those placeholders. So it is kind of like guidance for them to, how to build it up. And then once they have all the paragraphs ready, senior investigators, they sit together and try to develop connection between each paragraph. And then I think this is like really a good approach, which we are really using at the School of Medicine. So I just wanted to ask, do you also recommend to your students the same approach, like coming up with some outline and then filling out those placeholders?
Yeah, that's a great suggestion, Dr. Batra. Well, yes, I recommend to my students, but also for myself, do that as well. Sort of think about, okay, if I have 5 paragraphs, right? What is the bullet point, right, for my first paragraph? What's going to be the bullet point for my second paragraph, third paragraph, whatever, right? And so what is the sentence that's going to start that paragraph that then everything else is going to support that sentence, right? So I think of my paragraphs and the supporting sentence for each paragraph, and then think about, okay, so if I'm talking about, globally, we know that there are barriers to HIV testing, then everything in that paragraph is going to be talking about global barriers to HIV testing, right? But I do put those key sentences, not even as a sentence, but as a bullet point first. So I think that's a really good strategy to use, like kind of creating an outline. Also, a thing that I find to be effective for myself, I don't know if it's effective for everyone, is again that idea of free writing. So when I'm writing, I know, say again, I'm writing about HIV testing. So I know there are 36, 38, 30 something million people infected with HIV globally. So I might put an XX million people are infected with HIV globally. And then in brackets, I put cite. And then I go on to the next sentence. I don't stop my writing and go to the World Health Organization and look up the exact number of people infected with HIV and put my citation in right then. Because that kind of blocks the flow of my writing, right? So I use like XX when I know, like, okay, I know I need to go look up a number, I need to go look up a date, I need to go whatever, and put cite because I know I need to cite that, but I want to just keep writing and get stuff out of my head before I forget about it, right? So that free writing strategy works really good for some people, again, to keep from getting the writer block and just keep your momentum flowing.
Perfect. One last thing for our audience. I'm not sure if maybe some of you already know, we do have a UNLV Writing Center in the main campus, and that center is also open on Sundays. So basically from Sundays to Friday. And if you go to the website of UNLV Writing Center, they have resources related to, like, when you're writing, what are the transitional verbs that you will be using to make your writing cohesive. And there are a lot of materials there which will be really, really useful toolkit for all of you. So consider going to UNLV Writing Center, and one of their services is that, say you have your draft and you can meet with an expert, like who are expert in writing. You can sit with them and you can just go over all your grammatical mistakes or anything, or they will help you in even improving your flow of writing. So consider, because I have used, when I was a student, I have used that service a lot, and I learned a lot in terms of writing.
And also the book that I showed you at the beginning of this presentation, I use that for my technical writing class. And I have students who come back to me after years and say, I've still used that book. My first copy of the book has dog ears, coffee mug stains, maybe a few tears on it, because I use it all the time to remind myself about, how do I transition from one paragraph to the next? What do I need to include in my introduction and things like that? So it's a really good book for people who are either just learning to write or have been writing for a long time. I'm fortunate I get to review the book once a year for my technical writing class, but it's just a really good resource to have So I'd encourage you to look into that as well. It looks like Barbara Lewis has her hand up.
Yes, thank you for this great presentation, Dr.
Thanks,
Pharr. It
Barbara.
was excellent.
Thank you.
And also thank you for your course, which was just great. And I learned a lot. I wanted to ask you about the fact that I've been told that my dissertation can be written as 2 or 3 articles as a dissertation. And I wanted to know what you thought about that as the advantages of writing the dissertation as articles.
Yeah, that's something that the graduate college at UNLV recently implemented. It's called the 3-paper dissertation, and then schools can either say that their students could do that or not do that. And in the School of Public Health, we allow for that. I think it's just really important to talk to your chair about what does that mean. Do the 3 papers need to be all submitted by the end of your dissertation? Do they just need to be, like in progress at the end of your dissertation? I know some schools, like, they all have to have been submitted. Some, they want at least one to have been accepted. So just talk about that with your chair to make sure that that's feasible for you. But that does help alleviate this situation of the Dr. Morgan talked about, where now I have this 200-page dissertation that I'm going to try to break down into 3 articles. And how do I go about doing that, right? So there are advantages and disadvantages to doing the 3-paper dissertation. One is you have to write an introduction and then your 3 papers and then a discussion. And the introduction and discussion have to bring those 3 papers all together, right? So they have to be like in the same, they have to make sense to go together. It can't be, one paper is going to be about, patient care advocates, and then the next paper is going to be about smoking cessation, and how do I put those things together, right? So you just have to make sure that they go together in such a way that you could write a coherent introduction and discussion to bring those 3 papers together. But they certainly does have the advantage to not have to break them up at the end.
Thank you. The other thing that I wanted to know is, have you used REDCap, which I just found out about today, actually, as a source for surveys?
I'm sorry, I coughed right at the end of your question. Have I used
REDCap as a source for surveys, validated surveys?
Right. I have not. I don't know if anyone else, I don't know if Dr. Batra or anyone else has used it, but I'm not familiar with REDCap.
What question you have, Barbara, regarding REDCap?
If whether or not Dr. Pharr had used REDCap.
Oh, okay. No, meaning I'm asking, like, if you have any specific question related to REDCap, which I can answer.
Oh, okay. Maybe I'll do that offline then, because I see we're coming up on our time.
Okay.
Thank you so much. I appreciate that.
And I would just comment that while it is relatively new to our institution, it has been used at other institutions for a very long time, and can be used also to get, if you will, new services even off the ground, to collect basic data. Number of nonprofits use it to really gather their data, and I think probably Dr. Batra probably knows more about its limitations and so forth. Yeah. And I actually, if we don't mind, we have only 1 minute left, but sometimes we're in a situation where we are really engaging multiple authors. And one strategy has been to sort of divide the paper up, like, 1 or 2 people will take one section and the other section and so forth. Do you have any advisement on that? Because, theoretically, each might sort of be starting, not exactly with a blank slate, but with limited information from the other sections.
Right. Yeah, that can be a challenge, right? When you have multiple people writing a paper, to try to get it into one voice, because we all kind of write with our own voice, right? And so you don't want it to sound like one voice in the introduction, then another voice in the methods and results. I still think sort of coming at the paper from maybe starting with whoever's writing the methods and the results section, doing their parts first, and then sharing that with the people who are writing the introduction and the discussion, so that they know, what, especially the people writing the introduction, because you don't want to write an introduction like with the hypothesis that this are going to be your results, right? You want to know what your results were when you're writing the introduction. It helps, I think. So maybe let the results people write their section first and then hand that off to the introduction people so that they know, okay, the discussion people are going to want to write about X, Y, and Z because this is what we found. So I need at least need to mention that in my introduction, right? Because you could write an introduction and be like, oh, this doesn't really tie up with the results section, and so you kind of want to know that first. So if you can time it, right, so that the people writing the introduction have their results, then I think it goes a little bit more smoothly.